Ladies and gentlemen, good morning. My name is Anna Stylianides, and on behalf of the Falls Creek Diagnostics and Research Center, I would like to welcome you all here this morning and to thank you for taking the time to meet with us on this very momentous day. I would like to introduce Dr. Mark Godley, the founder and medical director of the Surgical Spaces Group. In addition, we are indeed honored to introduce and to have had the privilege of Dr. Marian Simca, who has spent 3 days with us at our facility, collaborating and working with our diagnostic team on this groundbreaking area called chronic cerebrospinal venous insufficiency, or CCSVI. Dr. Simca received his training at Silesian Medical University in Poland and has a PhD in medicine, and is also a specialist in general surgery and angiology. Dr. Simca, in collaboration with Dr. Zamboni in Italy, has been at the forefront of CCSVI when they met in London in 2006. Dr. Zamboni presented a paper on the possible link between MS and venous leg ulcers, and from that time, Dr. Simca took a keen interest in this area. In December 2008, Dr. Zamboni published a very important document demonstrating evidence of venous pathology in MS patients, and since then, Dr. Simca proceeded to work with MS patients in this area. They are currently, with his medical team in Poland, handling 20 MS patients a week in this procedure since last October. I would like to ask Dr. Simca to say a very few words on his work, and welcome, Dr. Simca. It's a pleasure to have you with us.
Good morning. It's a great pleasure for me to be here in Vancouver, Canada, and share some experience of our team with Canadian colleagues. You should know that the diagnosis of CCSVI is not very easy. It's very difficult to understand how to properly examine this patient, how to interpret this examination. So I think that sharing the knowledge is key in understanding and management of this patient and perhaps also in treatment of them.
At this point, I'd like to ask Dr. Godley to just say a few words as to what it has meant for our facility to participate in the studies and also to collaborate with Dr. Simca and Dr. Zamboni.
Thank you. We started looking at CCSVI and this disorder back in November of last year, and at the time, it's been a very contentious diagnosis, a contentious issue because of its association and the association that's been made with multiple sclerosis. And we knew that when we were going to get into this field that it would come with some controversy. However, this facility is such that I knew that we had to participate because we had some of the most advanced diagnostic equipment in Canada with the 3 Tesla MRI machine and all the latest software that could be used for the diagnostic abilities, and also having clinicians involved in our organization who are prepared to look at making the diagnosis of CCSVI. Up till now, we have imaged and worked on at least 90 to 100 MS patients, and we probably have done the most patients in Canada to date. The question here that a lot of people are asking is, well, is this the cause of multiple sclerosis? And we're saying no, we don't know that answer. We don't know, but we do know that CCSVI exists and that it needs to be treated. And if it can be treated, well, in patients with MS, are they getting better? And it seems that the evidence that is out there from patients who are currently getting treatment in many countries to date, either by angioplasty or stenting of the veins in the neck, are getting relief of symptoms. And so for the MS patient, this is of great hope. And for many patients that drugs are not working or drugs may not be that effective, this is a therapy that needs to be offered to people, irregardless of whether it's associated or the cause or the root cause of MS. So from our perspective, we are very pleased that we've been able to offer this service to patients and give patients choice to come here and take this information with them to receive treatment wherever in the world. And we hope that we can drive this process and bring it a little closer to home so that patients can receive care in this facility or in the public healthcare system over the weeks to months to come.
So where do patients go from there? If the treatment's not approved in Canada, they're given this diagnosis, then what?
Well, what we have to do right now is we have to find alternatives, find places where they can receive treatment.
So what do you want? Do you want to do it here at your clinic? Do you want Canada to pay for it? You know what?
I think that we would like to see patients not have to leave the country. We would like to see MS patients receive the care within the public system.